Okay, so we'll start off with auto and knee rolls. So if a patient comes in after any kind of trauma to their knee, if they meet any one of these criteria, they need to get an x-ray. And the first one is if they're 55 or older, if they can't take 4 good steps, even limping counts. So if they can limp, it's okay, it's a negative. If they have pain at the superior, lateral, or inferior poles of their patella, or at their fibular head, any of those, they need to get an x-ray. So to determine if there's any swelling around the knee, you can do the milking test. So you can put your bottom hand at about the joint line, and top hand is going to be above where the capsule starts, and then you're going to slowly glide down 3 times with some pressure and try and push that swelling and effusion down toward the joint line. Positive test would be extra swelling in that medial joint line or swelling around the patella and a springy patella. It'd be a positive test. So next we need to test the patella as far as its mobility. So in 0 we'll test and just see if it can medially and laterally tip. So just checking its pliability. And then from there, I'd normally be on the other side. We'll do it up at about 20 degrees of flexion. And you're going to try and push laterally and medially on the patella. And in theory, you should get 2 quadrants of movement for normal patella movement. And you'll also do superior glides and inferior glides of the patella, trying to determine tightness or imbalance between each side. All right, so we're going to test the MCL next with the Valgus stress test. So I'll have you scooch a little bit this way. There you go. So bring the patient to your side of the table, and then from there you're going to bring their lateral joint line onto your hip and palpate their joint line with your thumb. And we'll do the first test at 0 degrees, and you're going to try and give a valgus force to the knee. If there's gapping, it's going to be a positive test. There's 3 grades of tests, anywhere from partial strain all the way to a complete tear. You'll try to determine that from its amount of gapping. So then from there you'll test at 20 or 30 degrees of knee flexion. Same thing at joint line with your thumb, and give a valgus force. And if there's valgus with that, it'll indicate it's more of an MCL injury than at 0. If there's valgus at 0, it could indicate ACL or posterior medial complex issues. Okay, so next one we'll do LCL with check that with a Varus force test. So you're going to palpate the lateral joint line, and at 0 degrees you're going to give a Varus force. And if you see gapping, it's a positive test. That could indicate LCL and PCL damage. And then from there you'll do it at 0 or at 20 degrees of flexion. Try to get the same without rotating it. There we go. So gapping on that lateral side would be a positive test, and that would indicate more clearly just LCL pathology. So next we're going to try and determine if there is recurvatum at the knee. So you'll grab behind the ankle, bring them up and do a little bit hip flexion and knee extension, and you should see maybe 5 degrees of hyperextension, but not any more than that. Any more would be a positive test for recurvatum. And we'll go up and determine if there's any PCL issues. So you bring them up into hip flexion, and this is a Sag test. So you're going to hold at the ankle and look at that tibial tuberosity and see if there's any posterior sag that would indicate a PCL injury. Clancy, step up and indicate a positive PCL injury. Then from there we'll do another PCL test, the posterior drawer. sit on the patient's foot, bring them up in about 45 degrees of hip flexion and 90 degrees of knee flexion. Now you're going to seat your hands up as high as you can in the back of the leg and put your thumbs right on the joint line. And from there, you're just going to give a posterior glide to the tibia. Feel all right. And any excessive posterior translation would be positive for PCL injury. While we're in this position, we can test for the ACL with an anterior drawer test. So hand positioning is about the same. Seat it up as high as you can. Thumbs right about at the joint line. And then from there, with your arms extended, just using your body, you're just going to rock back and give an anterior glide to that tibia. And 3 millimeters or more of anterior translation would be a positive test and indicate an ACL injury. Okay, for another ACL test, we've got the Lachmann's test. And this one is going to be down lower in hip flexion at about 30 degrees, 20 to 30 degrees of knee flexion. So from here, you're going to seat your hands up as high as you can behind the knee. And grab the thigh with your dominant, with your top hand. And then from there, you're just going to give an anterior translation. And the same 3 millimeters or more of anterior translation is a positive test. Okay, so now we'll move into meniscus testing. So the first version of this is Steinmann's test. So you'll bring the patient from knee flexion, or knee extension into knee flexion. And a positive test would be posterior joint pain with knee flexion along the joint line. And when you move them into flexion, you should get an anterior joint pain specific to the joint line. That would indicate meniscus injury. All right, so our next test is McMurray's, is another meniscus test. So you're going to bring the patient up into 90 degrees of hip flexion and 90 degrees at the knee. And from here, all you're going to do is stabilize the thigh and then give an external and internal rotation force to that leg. And pain at the joint line would be a positive test for meniscus injury. So we have another meniscus test, Apley's test. So we'll bring a towel underneath the femur. And this is Apley's with compression. So you're going to give compression to the lower leg. That's going to load the meniscus. And then from there you can externally rotate the tibia. And that will load that medial meniscus. And then from there you can also take it through a dynamic range of motion to see if you can pick up any issues through a range. So that's an ER. And then to test the lateral meniscus, you move into IR with compression and then move through that same range. So those are the two different versions there. Next we have Apley's with distraction. So from here you distract, give a distraction force to the tibia. And that's going to it's going to test for LCL and MCL. So you're going to give some distraction and externally rotate. And that's going to test that MCL. If you get a positive result, you're going to get pain on the inside of the knee. If you give some distraction and internally rotate, which actually move pretty good, you get some pain on the outside of the knee. It's a positive test for the LCL. Okay, our last test is Thessley's. So you're going to have the patient take a single leg stance, and then from there they're going to go into about 20 degrees of knee flexion, and then you're just going to rotate through the tibia, internal and external rotation. You can give them a little balance if they need it. A positive test would be pain at the joint line, and it'd be a positive test for meniscus injury.